In today's video we are going to be talking about malaria. Once again, welcome to Medsplain, where we talk about complex medical topics in easy to understand ways. Remember that this is simply an informative medical video designed for further patient education. Any medical decisions should be left to the authority of a licensed physician or doctor. If you have any active medical emergencies or life-threatening symptoms, call 911 or your local emergency medical provider. Malaria is a mosquito-borne infectious disease caused by parasites known as plasmodium. The disease is transmitted through the bite of an infected female mosquito, where the parasite enters liver cells first, later on, red blood cells. Symptoms of malaria typically appear 7 to 30 days after infection and may include fever, chills, sweats, headaches, muscle aches, fatigue, nausea and vomiting. Some patients may show some of these symptoms, or none at all. People are at risk for malaria if they live in regions where malaria is endemic, such as Sub-Saharan Africa, South Asia, and Southeast Asia. Are a young child or older adult and thus have a weaker immune system. Spend time outside during peak mosquito hours. Live in areas with poor sanitation. Patients with malaria or those who suspect they may have been exposed should seek medical attention immediately. A trained physician will likely prescribe oral medication followed up by anti-relapse therapy depending on the strain of malaria they were infected with. Patients may also need monitoring and treatment for complications such as breathing support, fluid and electrolyte management, and treatment for seizures or shock. Patients with malaria should not be afraid to go to the doctor or refuse treatment recommended by a trained physician. In addition, they should not donate organs or blood. Patients should rest and hydrate themselves as best they can. After diagnosis, patients should refrain from consuming fatty, spicy, or processed foods, alcoholic or caffeinated beverages, and raw or undercooked foods. Treatments of malaria include chloroquine and artemether-lumefantrine, ACT, which are used as a first-line treatment for uncomplicated infections. Alternatively, quinine plus clindamycin may be used where ACT is unavailable or resistant. Later on, drugs such as primaquine or tafenoquine may be prescribed later on to prevent relapse. If you feel chills, headache, nausea, fatigue, or have unexplained fever or muscle pain, you should immediately contact your doctor. In severe cases, you may require immediate hospitalization and urgent treatment that focuses on your specific symptoms and medical history. Thank you for learning from Medsplain. We hope that our explanations were concise and easy to understand. If you have any feedback, feel free to comment or contact medsplainbusiness@gmail.com. Remember to like or subscribe to support furthering patient education.